concept analysis of moral distress. I'm Kirsten Poch.
I'm Misty Spillman.
I'm Mary Frances Cypher.
And I'm Faye Malone.
Background and significance. Andrew Jameson introduced moral distress in 1984. He defined it as psychological disequilibrium that results from knowing the right thing to do, but not being able to do it due to inhibiting medical power structure or institutional policy. Other researchers and ethicists have developed definitions after Jameson. For example, in 2002, Mary Corley introduced that moral distress among nurses occurs when the nurse knows what is best for the patient but is unable to complete the task because it conflicts with the institution or other healthcare providers. Moral distress is significant to nursing because it is seen in all areas of nursing and has the potential to negatively impact patient care. Negative symptoms of moral distress include anger, frustration, guilt, and anxiety. All areas of healthcare experience moral distress. Moral distress can result in job burnout and dissatisfaction. Meaning in published works. Many studies have been completed on moral distress. In the first study, Wigland and Funk in 2012, the purpose were to determine situations that prompted moral distress, the consequences of moral distress, and would the nurse act differently in similar situations. The details of the study are the nurses had to describe situations of moral distress. The most common reported situations were end of life, disclosure or non-disclosure of patient information, maintaining patient and nurse safety, and lack of work ethics. The results were 79% of nurses experienced moral distress. The consequences reported were feelings of anger, frustration, and guilt. Most nurses reported they would not change their practices. The second study, completed by Pauley, Varco, Storch, and Newton in 2009, was completed to determine the level of moral distress, to determine the idea of ethical climate, and to determine the relationship between the two. The details of the study were the cross-sectional survey used using the moral distress scale and the hospital ethical climate survey. The findings were there were increased levels of stress related to unsafe nurses, and increased levels of stress in ethical climate were related to managers. There is a positive yet complex relationship between ethical climate and moral distress. In the last study, DeVere, Franck, Struges, and Willems in 2013 completed a study with a purpose to develop the understanding of moral distress in multiple settings, including inpatient, outpatient, acute, and chronic care settings, as well as to determine if there were any personal characteristics that attributed to moral distress. The details of the study include a two-part cross-sectional correlation study. The findings were oncology and transplant nurses reported highest levels of moral distress. The highest reports of moral distress included fulfilling family wishes for patient care when knowing the patient had different wishes, as well as complying with doctor's orders when the nurse disagreed. There was no relationship between personal characteristics and moral distress.
My name is Kirsten Poch, and I'm going to talk about the purpose of moral distress. Chin and Kramer discuss conceptual meaning as the feelings and thoughts that come to mind about a given term. Avant and Walker state concept analysis helps for researchers and theorists to help get inside the concept and to discover how the concept works. It's important to clearly state the characteristics, and that helps to reduce any confusion between similar topics. The end result of concept analysis is tentative for several reasons, and that's due to no two people are going to define the same characteristics about that concept. Also, changes are due to contextual, cultural, and societal factors. Avant and Walker state there's three important purposes to moral distress. The first one is it helps define difficult terms. It also helps define overused terms and improves nursing language. Concept analysis improves communication among researchers and theorists and helps to create different ways to evaluate concepts.
Hey, my name is Mary Frances Cypher, and I'll be talking about the defining attributes of moral distress. According to Walker and Avant, the defining attributes discuss the importance of determining the concept analysis. These defining attributes, if done well, should immediately call the concept to mind. There are a set of criteria that must be present in order for the concept to be present. In addition, they are not stagnant and may change as the concept over time changes. For moral distress, we came up with 4 different concepts. The first one being that there must be at least 2 parties involved. The primary party is the one who is experiencing the moral distress. The secondary party is the one which is inhibiting or preventing the primary party from completing the course of action which they feel is right. Secondly, the primary party is confident in the right course of action. Thirdly, the primary party is prevented from pursuing the right course of action due to the second party. Fourth, the primary party experiences feelings of powerlessness, guilt, or depression due to the situation. The definition that we came up with for moral distress includes a feeling of powerlessness experienced by a primary party brought on by an ethical situation in which the primary party knows which course of action to take but is unable to pursue this course of action due to inhibitors related to the secondary party. Our group used all different kinds of sources to come up with this definition. According to Chin and Kramer, some of these sources could include dictionary definitions, existing theories, visual images, anecdotes, popular and classical literature, and poetry. For our purposes, we used dictionary definitions as well as literature sources and visual images, as you can see right here.
I am Misty Spillman, and I'm going to talk about one of the different types of cases. First case I'm going to talk about is the model case. Chin and Kramer define model case as a portrayal of a situation that complies with the statement, if it is not X, then nothing is. Walker and Avant define the model concept as the model case demonstrates all vital attributes of the concept. The scenario that I used was Ms. Jones was hospitalized with terminal cancer as a DNR status based on her verbal request. The patient's condition started to deteriorate and the physician phoned the son to inform him. The son then revoked the DNR order. The patient was transferred to ICU and the nurse began caring for the patient. The patient told her that she was ready to die. Her condition continued to deteriorate and the nurse called the doctor, arguing with him over the situation with the DNR. During that time, the patient had to be intubated. The nurse felt moral distress with the decision because she knew that was not the patient's wishes. The second case I'm going to talk about is the related case. Chin and Kramer define the related case as situations that characterize a different but comparable concept. Walker and Avant define related case as similar to the concept but do not contain all of the vital attributes. The scenario here is Mary is a 21-year-old patient that is scheduled for an elective total hysterectomy due to finding precancerous cells at her last cervical cancer screening, as well as a strong familial history of cervical cancer. The nurse performing Mary's preoperative care is recently married and has plans for several children. The nurse is able to perform the physician's orders as well as follow through with her care for the patient, despite her feelings of emotional anguish over the situation.
My name is Kirsten Poe, and I'm going to discuss borderline case. Chin and Kramer define borderline case as a metaphor or pseudo-application of the concept that is used. I use the example of Mr. J as a patient. He goes into cardiac arrest when he's out eating with his wife. He's transferred to the local emergency room resuscitative efforts are done, and he is transferred up to ICU. Mr. J had discussed with his family prior to his cardiac arrest event that he wanted to be a DNR. The nurse taking care of him happens to be a family friend and knows that he would have liked to be DNR. His wife told the physician that she would like to pursue all efforts and revoke the DNR. The physician discussed with the family the poor outcome at this point, and later that night, Mr. J did go back into cardiac arrest, and Susan, the nurse, has the conflict of following out Ms. J, the wife's desire to go ahead and revoke the DNR, or to go ahead and pursue the DNR orders, even though she's been told the outcome's going to be poor at this point.
Hi again, I'm Mary Frances Cypher, and I will be discussing the contrary case. Chin and Kramer, as well as Walker and Avant, both have their certain definitions that go with the contrary case. They're very similar, but, and again, we will go over them. Chin and Kramer define the contrary case as a situation which is certainly not indicative of what moral distress would be. These are similar, but they're easily recognized as different from the concept. Chin and Kramer say that sometimes there is a tendency to simply reverse the model case to depict the contrary case. However, this doesn't show any new type of information and is not advised. Walker and Avant describe the contrary case as one that exemplifies also what the case is not. They're often very helpful because it points out the clinical attributes of the model case. For my contrary case, I came up with a scenario where a patient is recovering from a coronary artery bypass surgery and is suddenly experiencing left-sided weakness as well as slurring her words. The family is at the bedside and they ask the nurse why the patient is acting strangely. The nurse immediately suspects that the patient is having a stroke, but she is caught whether or not she wants to immediately tell the family, hey, I think this patient is having a stroke, or abruptly leave the room to go tell the physician. Not wanting to cause any type of alarm, she is stuck in the situation, not knowing what to do. This differs from moral distress in that the nurse has two justifiable options. She doesn't know what course of action to take, whereas in moral distress, the nurse is confident of her decision.
Hi, I'm Malone, and I'm going to be discussing the invented case. The invented cases are examples that incorporate ideas outside our own experience in an effort to further explain the defining attributes of a concept. The example I have listed is as follows. A Martian nurse named Marcy was assigned to a dying patient, the care of a dying patient. The patient's death was inevitable, but Martian law dictates that the Martian MD decides the final treatment of all patients. The MD has chosen to continue treatment, including mechanical ventilation and vasopresses, in order to complete an experiment. The MD is aware that this type of care is against the dying patient's wishes, and also that this care is futile and unnecessary. The MD plans to continue all care anyway in an effort to complete his experiment. Any Martian nurse that objects to or disobeys MD orders is banished to planet Earth. Marcy is experiencing moral distress related to the lack of respect for patient wishes by the MD and also the inappropriate use of healthcare resources. This invented case conveys all of the critical defining concepts of moral distress.
My name is Kirsten Toe, and I'm going to go ahead and discuss antecedents and consequences. According to Chin and Kramer, antecedent concepts are experiences that occur before other concepts. Nurses may experience feelings of role strain between the nurse and the patient, and internal conflict between the nurse and the current situation. Consequences occur after other concepts, and some of these descriptive feelings that nurses may have are sadness, helplessness, failure, uncertainty, anger, self-doubt, and ruminate, which is the replaying of events and creating different scenarios.
I'm Malone, and I'm going to be discussing the empirical indicators. Empirical indicators are related behaviors of a concept that are assessed in a specific study, and these indicators also identify the experimental tools of the research study. Some empirical indicators of moral distress are moral distress frequency, which is defined as how often the nurse experiences the painful feelings associated with the distressing situation. Another empirical indicator is moral distress intensity, which is defined as the level at which the nurse experiences painful feelings related to a given situation. Some painful feelings associated with moral distress are frustration, powerlessness, hopelessness, grief, and misery. Operational definitions provide the exact means of measuring the concept of a study. The definition contains two parts. The first part provides the general meaning of the concept, and the second part distinguishes related behaviors of the concept that can be assessed. An operational definition of moral distress is: moral distress is discomfort or internal conflict related to a clinical practice situation manifested by frequency and intensity of the negative feelings of frustration, powerlessness, hopelessness, grief, and misery that are associated with moral distressing situations. In this case, the frequency and intensity of the negative feelings associated with moral distressing situations could be easily assessed in an experimental study.
Again, I'm Mary Frances Cypher. I will just be doing a brief summary about what we have talked about throughout this presentation. In summary, the concept of moral distress is a multifaceted idea which has many components to consider. Considering the background and meanings in published works as we discussed earlier, the tentative definition of moral distress was formed. From this definition, the defining attributes were defined and discussed. Using the methods described in the works by Trennan, Kramer, and Walker and Avant, 4 types of case studies were created. The model exemplar, related, borderline, contrary, and invented cases were presented, each with an example created by our group. The purpose of these cases is to point out the differences between moral distress and any other type of concept. These cases refined the mental image of moral distress that the group wished to portray. The essential conditions for the presence of moral distress were discussed as antecedents. The consequences or outcomes were identified. The quantitative and qualitative criteria as empirical indicators. Finally, an operational definition was formed, and this completes our presentation.